Dr. Kardasis, thank you so very much for being here today.
It's
We
my
are
pleasure.
honored to have you here. And let's start off by just hearing a little bit about your background.
Well, I've been in the community practicing ophthalmology for 25 years as a private practitioner.
Okay.
And I hail from Chicago, born and raised.
Okay. What part of
And
the city? Just out of
Well,
curiosity?
actually I grew up in Austin.
Okay.
Then I moved north, became a Cub fan,
All
unfortunately.
right.
And
I won't hold that against you.
I attended Lane Tech High School.
Okay.
Then did my undergraduate studies at Loyola, and then moved on to Northwestern for medical school. And then I stayed on for fellowship there, as well as internship and residency at Illinois.
Okay.
And then I did my surgical residency out in Michigan at the Presky Eye Institute.
Okay.
Detroit.
Okay. What made you choose a career in ophthalmology?
Everyone asks me that question, and all I can say is children are very impressionable. And at the age of 9, I woke up one morning unable to see, and I didn't know what was going on as a young kid. Maybe the sleep in my eyes, and I waited, and it didn't work. So my parents took me to an ophthalmologist. It was the first physician I've ever encountered, aside from a pediatrician, but you know, with all due respect to pediatricians, I just remember them as giving shots, coming over and giving one and leaving, and so you don't quite connect with them. But an ophthalmologist who can restore vision, which is what he did with a prescription pair of glasses, and made a lasting effect on me.
Lasting impression.
Yeah.
You understood how that impacted you,
Yeah.
and you wanted to be in the position to help others in
And
that
I
manner.
tell others, I mean, you don't realize how impactful you can be, even in the slightest way, with young people.
That's right, that's right. So 25 years out here in the Southland, you've been practicing ophthalmology?
That's correct.
All right. So let me ask you this. So I understand that January is National Glaucoma Awareness Month.
That is correct.
Why do you think it's so important for folks to understand and be focused on glaucoma?
For the very fact that in the earliest of stages, first of all, glaucoma is a disease of usually high eye pressure,
Okay.
without any symptoms, that can cause damage to the optic nerve, which is the cable that connects the eye to the brain.
Okay.
So having said that, in the earliest of stages, there are no symptoms. There's literally no warning sign.
Wow.
You don't feel it, you don't see it, you don't know it's there. And the most important thing is to be aware of the early stage so you can treat it.
Okay.
But without symptoms, you don't know.
Right.
So it falls upon the individual to make an appointment and to come in and get examined. Some of the warning signs may be, if you've heard of that brother or sister or mom and dad has it, that increases your likelihood because it's a genetic disease.
Oh, wow.
It runs strongly in families.
Okay.
If you're a diabetic, there's also a chance that it raises your risk,
Okay.
hypertension. So when you have that kind of background and you hear those kinds of stories among family members, it's really prudent to go in and get examined.
Well, you have just inspired me to make sure I make my next eye appointment. My mom did have glaucoma, and I have a sister who just recently had surgery to remove some, I guess, tell us a little bit about the process of correcting glaucoma.
Yeah, so there's various stages or tiers on how to address it. Most people, thank goodness, are well managed with topical drops.
Okay.
Because we're catching them early in life, in their development. And drops, we have a whole plethora of categories of mechanisms of action, unlike 20, 30, 40 years ago. And we can attack the disease multi-pronged by various mechanisms. So we can suppress it. Let me just back up for a moment and say, as I stated earlier, it's a disease of high eye pressure. How does one control it? One needs to lower the pressure. And you do that with topical drops. So that's the first level of management, lowering the pressure to decrease the risk of progression of the disease. And let me say, in medicine, we're treating, we're not curing. Very few things are curable. But that's the first level of treatment. If majority of Americans are well managed at that level. Now, there are some people that will break through, either because the drops don't work or they're at a more severe stage of glaucoma that requires augmented treatment. Along with the drop, one may need a laser treatment, so that's another layer of management.
Okay.
And then beyond that, there are surgical options, and that's what's exciting about this area, because The jump from the laser to surgery was a very dramatic jump. In the old days, we'd had very aggressive approaches surgically to lowering pressure that had a larger inherent risk of complications. There's a gap now there that has been filled with what we call MIGS devices, minimally invasive glaucoma surgery. That's the acronym.
Thank you.
And it's done either by microscopic stents that provides a new conduit to lower the pressure, or we even have procedures that take the natural anatomy of the eye and enhance it, augment its function. Kind of like what I'll tell my patients is, if you have a problem with your sewer line at home, you call your plumber, he comes over, he rods your line, and things flow faster.
That's right.
That's essentially what I do in the OR.
Wow.
So by augmenting that drainage system and allowing it to flow faster and more freely, then you're lowering the pressure and you're treating your patient better.
Is there anything that individuals can do to relieve or to prevent pressure from even developing in that eye cable as you described it?
Take your medications, follow up with your doctor.
Okay.
Really
so
the best advice.
it's nothing environmentally that people are doing. I'm trying to get at
is there something
staring at the screen all day, does that create more pressure? Maybe the video games, you know, technology has basically taken us into another space that we hadn't been in historically. So I'm grateful for the advancements with the medical corrections, but when I think about how much time we spend looking at laptops and iPads and tablets and computer screens and televisions, I wonder if that plays any role on some of the eye conditions.
I understand your concern. I get these questions all the time. What is the new world? What is the new life in the 21st century doing to my eyes?
Right.
It's causing a lot of strain. Our livelihoods are in front of screens for the vast majority of the employed population. Unfortunately, I can't give you any sort of behavioral recommendation other than to live a good, healthy life. And glaucoma, as I mentioned earlier, is a genetic disease. So in some respects, we're predetermined to develop it if we have the gene. But there are things we can do to augment or mitigate this situation, and that is living a good life, controlling your comorbidities. If you're a diabetic, control your sugar.
Right.
If you have hypertension, control your blood pressure. All of this feeds into not only the health of your body, but also your vision. So the eyes are an extension to the body, as someone said, and it's important that things do matter locally and systemically, and vice versa. So we're very complicated human beings, and one thing leads to another, so it's important that we take care of ourselves as a whole.
I agree. So I did, of course, do a little snooping on you, and I see that you come very highly rated. Are you still open to receiving more customers? Because I'm sure behind our viewing audience, hearing and learning more about glaucoma through Glaucoma Awareness Month, I'm sure more folks will be looking for a great optometrist.
Well, number one, I'm an ophthalmologist, so there's a difference between optometrist and ophthalmologist. And number two, I have patients, I don't have customers.
Gotcha.
As much as people would like to take medicine and turn it into a business, I don't think of it as.
I appreciate that.
Kindly accepted. And so, yes, I am open to seeing new patients.
Gotcha.
And I want to make myself available to the community. So I know that there are difficulty getting in to see doctors sometimes. People complain about access. My office tries desperately to make ourselves available and to include ourselves on most of the plans that are out there. And this is the time of year where there's a lot of change, and some plans come and some plans go. So we try to stay on top of things and try to be within the network for people's insurance.
Okay. So I know primarily the residents who live here in Hazel Crest will be viewing this show. However, every person viewing the show, I'm sure, has family members. As an ophthalmologist, are there other places that you are able to see patients in the event that folks don't live here in the south suburbs?
Sure. I have an office in Evergreen Park.
Okay.
So if some folks have family in the city, 95th Street at 3300 West 95th Street, which is between Christ and Little Company Mary Hospital. And a lot of Chicagoans know those two hospitals well because it serves a lot of Chicagoans in the Beverly area as well as the surrounding suburban community. And if you're a North Sider, I do find myself up at Lutheran General at Park Ridge, although that's a very part-time exposure.
Okay.
predominantly a South Side
Okay. All right.
family eye physician.
So if you had three main points that you would want to drive home for anyone who is paying attention, anyone who's watching this program. Again, January is National Glaucoma Awareness Month. We have a wonderful resource sitting here with us that's sharing information, Dr. Kardasis. And so if there were 3 points that you wanted to really, really drive home, what would those 3 points be?
Number one, it doesn't mean you'll have glaucoma if there's family with glaucoma. But the number one point to me is get yourself examined. As I said earlier, you have no warning signs for glaucoma. There are people that can acquire glaucoma with no family history. So if you are older, if you have these comorbidities, diabetes, hypertension, if you have a family history, get yourself checked out. The least you can do is come home saying that I don't have it, I don't have anything to worry about. But if you have those risk factors, with every year of life that passes, the rate of progression or the risk of developing glaucoma goes up. So you may have a good exam this year, but that doesn't give you an insurance policy for the future. You have to be vigilant. You have to go in every year and get yourself examined.
Sure. And just for my edification, as well as anyone else who's listening, the difference between ophthalmology and ophthalmology. Let's discuss that.
Yeah, well, the ophthalmologist, the longer word, we're MD trained, so we've attended medical school and we've been trained in both medical school and internship and residency, and many of us in fellowship. And so we're under scrutiny and continue to be under scrutiny, as well we should, because we have a fiduciary duty to the public health interest. And so we're certified, and we constantly get proctored and monitored every 10 years on that competency. Optometry has a college of optometry that most optometrists attend, and historically they've sort of morphed into a different way of practice, but essentially they're not medically trained, essentially, and they're more interested in the optical aspect of eye care. But there are a number of people now that feel more comfortable, and legally they're licensed to do more in the area of medical eye diseases.
Gotcha. So
But I just want to make that distinction. They're not medically trained, but yet they have a license that allows them to do more than in the past.
So what I would intend to do as a potential patient, if I need to get my prescription for my vision checked out, I'll go to an optometrist. But if I need some type of invasive or non-invasive surgery to correct anything with my vision, then I'm going to go to an ophthalmologist.
I think that's reasonable, and in fact, the vast majority of my patients have both an optometrist and myself included. So they know that if you're getting older and you have comorbidities, we all have, I mean, our two professions are complementary. And I work with many optometrists who refer to me, and many of them are, you know, are very comfortable with the situation. They're willing to deal with the optical issues, and I'm willing to do with the medical. So I don't see anything here that is at all antagonistic.
Gotcha. Dr. Kardasis, thank you so very much for sharing this information with
You're
us,
welcome.
for imparting your wisdom with us. January is National Glaucoma Month. Please, Glaucoma Awareness Month, please get yourself checked out. If you haven't been checked out, the good doctor has let us know that it could be related to genetics, it could be related to some other comorbidity. It's basically important that you get it checked out, and get it checked out before it progresses too much. So again, thank you so
You're
much
welcome.
for your time.
And Benita, I just want to say, to be aware is to be examined.
That's good. It's the difference between wisdom and knowledge. You can know something, but until you operate in it, you don't have wisdom. So get examined, get your eyes checked, make sure
The
that
only
you
way
don't
you'll
have
know.
any. That's the only way you'll know. Make sure that you don't have any glaucoma lurking in the back of your lenses. All right, thank you so much.
Oh, you're welcome.
All right.
It's a pleasure. Happy New Year.
Happy New Year.